The coronavirus pandemic continues to take a toll on the well-being of children and young adults. While studies suggest they're less likely to get infected with the coronavirus compared to adults, they're still experiencing major life changes and stressors. And as Sarah Daloff reports, that's impacting their mental health.
Disrupted routines, separation from friends, and for many, no in-person school come fall. The pandemic is wearing on the mental health of children and teens.
About 1 in 6 children in America have a mental health disorder. And in the context of the coronavirus pandemic, we expect this to increase.
Across the board, health experts are seeing more symptoms of anxiety and depression. In younger kids, that may manifest as tantrums or behavior regression. Older children may be more agitated, angry, or withdrawn. Having a trusted adult to walk kids through those emotions is key.
Name the feeling for them. I see that you're angry that you can't hang out with your friends right now, or you're really worried that something bad is going to happen to mom when I go to work. So help them identify those feelings and then help them with ways to work through that and build resilience.
While most kids will remember the pandemic, like how their grandparents and great-grandparents recalled the Depression, it won't interfere with their development. But kids with pre-existing mental health conditions are at heightened risk. A survey of 2,000 young people with mental health histories in the UK found 51% reported coronavirus has made their mental health a bit worse. 32% say it's made it much worse.
We know that those children are at higher risk for developing longer-term psychological impact from the pandemic.
Even during the summer, health experts say establishing routines and structure can help. So can time outdoors and time with family or chatting with friends via social media. Watch for changes to appetite and sleeping habits, as well as personalities. Big shifts are signs it's time to connect with a mental health expert.
A new study suggests several steroids could be effective in treating some COVID-19 patients. Researchers looked at more than 1,800 hospitalized patients. 140 of them were treated with steroids, mainly prednisone, within 48 hours of admission. Nearly all had a blood test to measure levels of a protein made in response to inflammation. In those with high levels of inflammation, they found steroid use reduced the risk of dying or being placed on a ventilator by 75%. But that risk increased nearly 200% if they were given the steroid with a normal or low level of inflammation. Police in Chile are training dogs to detect the coronavirus. These dogs have already been working for years to smell explosives, and trainers say they just have to teach them to recognize a new smell. While the coronavirus itself is odorless, the dogs can be trained to detect a certain type of sweat that the infection generates. Dogs in Germany, Finland, France, and England are already able to detect the coronavirus, even in asymptomatic people.